So after a very nice introduction about today's body contouring program, now lifestyle and the dermatologist. So when I started preparing this presentation, seriously, I was very confused about what to include in the slides, what to omit, because there are so many things given up there. It was a little difficult for me to compile. So at the end of the presentation, I would request Dr. Ajita to add if I have missed any points here. So to begin with, all of us know skin is a very important organ and it's a reflection of general health. So treating the condition inside out will address the underlying cause and also prevents recurrences. And that has been the motto of all the dermatologists at Oliva. But I found this new term which was very, very interesting, holistic or integrative dermatology, which involves treating not only the cutaneous things but also the underlying problems so that the dermatological condition shall improve in conjunction. So understanding this interplay between these lifestyle factors which can modify the outcome is very, very important, and it definitely forms a major role. So there are many dermatological conditions which can be prevented by modifying the lifestyle factors, majorly including diet, sleep, exercise, stress, alcohol, and smoking, which are the major things where I could see some good scientific evidence. And this will also help to mitigate the skin disease. So what is the role of a dermatologist? We occupy a unique position to encourage our patients to enact positive lifestyle changes. I'm sure they may go to the physical trainer, they may go to a nutritionist, but the main scientific reason, as we can explain to our clients, nothing can beat that. And patients' concern can be used as a very good opportunity to modify the inappropriate lifestyle habits they carry. And we can also play a major role to impact the future morbidity and mortality. We can motivate the patients to make changes that help them increase the healthy lifespan and quality of life as well. So, last but not the least, we can decrease the disease burden and also lower the medical costs. So the major lifestyle factors which affect the common skin concerns that we treat in our day-to-day practice are diet, sleep, exercise, stress, alcohol, smoking, and drug abuse, which is though very common in the Indian subcontinent. So these are the various skin conditions that have been linked to the various lifestyle factors. I would be dealing with the most important ones that we usually treat. And I think this is the most important slide for all of us, insulin resistance, which has a bearing on acanthosis, acne, psoriasis, and there are conditions which are potentially associated with insulin resistance. The most important thing that we treat day-to-day, androgenetic alopecia, hirsutism, and any other signs related to hyperandrogenism. And there are anecdotal evidences which talk about alopecia areata and vitiligo also being associated with lifestyle factors. So with relevance to our practice, which need intervention include acne, hair loss, hirsutism, acanthosis nigricans, and most importantly, the aging changes as well. So let's just look at few points about how each lifestyle factor can cause a difference. So alcohol, it is said to increase the skin permeability with defective barrier. It delays the wound healing, decreases antioxidants, and it causes a lot of changes in lipid and bile salt metabolism, can cause immunosuppression, etc., which can lead to cutaneous changes. And diet, most importantly, high serum insulin and IGF-1 increases sebum production and androgen synthesis, and thereby there can be accumulation of advanced glycation end products and decreasing skin elasticity. So exercise, regular moderate intensity exercise protects against oxidative stress mediated by reactive oxygen species and helps maintain the redox balance in the body. Sleep, one more important thing we often don't know, like most of us work late nights, and there are so many software people who do not sleep properly, they work in night shifts. So slowly the sleep is also catching this. This is forming a major lifestyle factor which needs some advice from our side. It so happens that if it is inadequate, it can increase the glucocorticoid production, it can alter the HPA axis, it can increase matrix metalloproteinases and certain cytokines like interleukin 1b, and then also cause collagen inhibition of collagen production. Smoking, it can stimulate dermal matrix metalloproteinases, downregulation of TGF beta, etc., and it can cause microvascular damage to the hair papilla as well. That's the reason why we are very strict about the smokers when we convert them for PRP. Of course, light smokers, we have a slight relaxation. Stress, again, is one more major factor. Everybody goes through stress, whether it is work-related stress or psychological stress. It causes increased glucocorticoids through the HPA axis, and there is definitely an impairment of skin barrier. There's inflammation due to release of substance P, etc., causing a lot of skin changes. So what are the general recommendations that we can give? Mostly refraining. If you take about alcohol, it's very difficult for us to control their will to quit alcohol, but of course we can always tell them that they can cut down the alcohol, and ingestion of antioxidants, of vitamin C rich fruits, polyphenols, etc. Then diet rich in yellow-orange fruits, which can help them. Such diets with micronutrients minimize any inflammatory skin conditions, have little bit of good effect on anti-aging. And most importantly, regular moderate intensity exercise. This can decrease the risk of many conditions like acne, insulin resistance, etc. And sufficient sleep definitely improves skin texture and tone, at least 6 to 8 hours of good sleep. So there are very good papers which talk about lifestyle interventions. The most important concern that we treat includes PCOS. All of us have been dealing with it day in and day out. It seems that once the patient or the client does good activity, good physical activity, it improves both the biochemical and clinical signs of hyperandrogenism. It may improve the lipid profile. Most importantly, the anthropometric markers, the weight and BMI, which we are going to discuss throughout the day, definitely improve. Very mild loss of 5 to 10% of weight also can increase a lot of the quality of life, and there could be clinically significant differences. And not only normally we say 5% of the body weight, but even a very mild weight loss of 2 kilograms to 3 kilograms weight is also associated with reduction in impaired glucose tolerance, and all the markers of insulin resistance can come down. So, and it can also improve the quality of life. So given the role of insulin resistance in the pathophysiology of PCOS, it's very important for us to guide them regarding the physical activity. So there's another paper which talks about excellent weight loss through lifestyle alteration leading to even regulation of menstrual cycles and reproductive outcomes in women with PCOS, though it may be a little offline to our discussion, but I thought we should include this. And there is a little support about moderate diet with carbohydrates, poly and monounsaturated fats, but I think Brunal will be the better person to tell us about diet in PCOS. And coming to activity, aerobic activity is at least less than 150 minutes per week. They say that there may be no weight loss or minimal weight loss, but 150 to 225 minutes per week can cause a weight loss of 2 to 3 kgs. So, Mrinal, what is your experience? I would like to hear from you. Yeah, so this particular paper says, so I was a little surprised when I saw this, like less than 150 minutes cannot cause any weight loss or minimal weight loss. So this is a timeline given where you can expect some weight loss to happen. But of course, there are so many confounding factors which also play a role. So this graph was very, very interesting, which also showed decline in HOMA-IR with regular physical activity. This shows how important physical activity is in addition to the balanced diet. So this is one paper which talks about therapeutic lifestyle program. So the American Heart Association considers this as the first line treatment for any cardiovascular diseases or to improve the quality of life. And they talk a lot about this program. Basically includes balanced diet, like how we have our beyond weight loss program, proper physical activity which is monitored every 2 to 3 weeks, just the same way that we are doing at Oliva. So I thought this is a very interesting thing which can have a lot of effect on our day-to-day skin concerns. So coming to the specific conditions and recommendations, acne, all of us know high glycemic load containing food are attributed to acne. So we should ask them to avoid high glycemic index foods containing sugar, white bread, white rice, etc. Because the reason is very obvious. Insulin and IGF factor 1 have been shown to augment sebum production, stimulate adrenal androgen synthesis, and increase androgen bioavailability. So there is a lot of evidence which shows that high glycemic load diets may exacerbate acne, but the role of omega-3 fatty acids, dietary fibers, antioxidants, zinc and iodine, they still remain to be elucidated. Though zinc, we have some papers talking about anti-inflammatory effect in acne. Then coming to sleep. Poor sleep quality has been linked to an increased risk of many conditions, including diabetes, insulin resistance, which can overall cause severity of acne or exacerbation of acne. Then coming to the most important concern that we treat, hair loss, which includes androgenetic alopecia and alopecia areata. So alopecia areata, again, many factors, we all know that there is Th1 and Th2 response playing a lot in the pathogenesis. So alcohol, sleep, all of them are supposed to play a major role in the pathogenesis. Alcohol consumption impairs the pathogenesis of alopecia areata, and sleep can delay the anagen progression. The circadian rhythm is regulated by clock and clock genes, whose deficiency can delay anagen progression in alopecia areata. So obesity, once again, there is alteration in the immune response. Th1 mediated contact hypersensitivity response increases, and it delays the clearance of skin inflammation. This again can add to the hair loss. So once again, we are coming back to the same thing, physical activity and nutritional advice. So diet, still we do not have a proper clinical data regarding gluten sensitivity or omega-3 fatty acids, but we all know that we have to suggest them iron-rich food. We talk about serum ferritin, vitamin B12. Though we call ourselves as non-vegetarians, having it once or twice a day is as good as a vegetarian. So you have to talk about the right amount of protein that they need to take. Then we all know that androgenetic alopecia, especially the vertex pattern, is associated with metabolic syndrome. Sometimes there are many papers supporting it. So hair loss could be associated with metabolic syndrome. So it's important to treat the hair loss on an equal footing with lifestyle related treatments. That is, again, diet, exercise, sleep, stress, etc. So lifestyle modification is in androgen excess hirsutism. We all know we do BCA, our target is to reduce the HOMA-IR and also bring down the BMI. Along with the hyperandrogenism, we have to treat the insulin resistance as well. Then recommendation for patients with PCOS in view of the improved reproductive and cardiometabolic outcome is aerobic physical activity of moderate intensity for at least 90 minutes per week. So this showed a lot of improvement in the metabolic profile, and it also reduced the risk of diabetes mellitus or insulin resistance or cardiovascular diseases, etc., which are related to PCOS. Then acanthosis nigricans, the most important thing that we treat, again, obesity related, diet, exercise, behavioral modification, all play a major role. Aging skin. So I'm sure many of the clients ask you like what kind of diet they can have to maintain their skin. So it's seen that ingestion of sugar can accelerate signs of aging because it promotes the cross-linking of collagen fibers, and once this cross-linking happens, the body is never able to repair these cross-links. So with this accumulation of AGs, that is advanced glycation end products, there are a lot of structural changes that are happening in the skin. So since it remains impossible to repair cross-links, dietary prevention becomes important. Of course, diet alone cannot do. We have to have a exercise, diet, as well as our procedural treatments as well. And there is also some evidence talking about cooking processes that can lead to higher levels of AGEs, including frying, roasting, and grilling. So you have to tell your clients that they have to be very careful while preparing the food as well. And then smoking. Smoking, we all know, smoker's face, it improves, it causes the microcirculation derangement, and it can cause extra cellular matrix turnover by elevating the levels of dermal matrix metalloproteinases. And exercise, again, delivery of oxygen and nutrients to the skin, it can promote collagen production. And Crane and all found that men and women aged 40 years who participated in more than 4 hours per week of high-intensity aerobic exercise had a thinner stratum corneum and a thicker dermis than individuals who participated in less than 1 hour of exercise per week. So there was a proper study done, dividing the people into 2 groups. And then one group exercised for 4 hours, and the another group exercised for 1 hour, and that also made a lot of difference. So now we realize what is the importance of exercise in anti-aging things also. So stress, of course, again, activation of HPA axis, repeated and prolonged cortisol exposure can lead to cortisol dysfunction, ultimately resulting in reduced immune function, impaired wound healing, increased inflammation. Again, the chain of events go on. So what are we supposed to do? Now, the media or whatever has been portraying that dermatology is a specialty centered only around the skincare and anti-aging. But in fact, this has led to believe that the sole role of dermatologists is just to protect the patients from displaying outward signs of aging. But this is grossly oversimplified because we know how complex the skin conditions can be. It also misrepresents the role of dermatologist. We are clinicians. We have to treat holistically. That is why the term holistic dermatology has come up. And we have always followed, even before we have read it in papers, we have been following. At least from the time I have joined Oliva, we have been talking about holistic improvement. So what can a dermatologist do? We have to follow evidence-based practice. We should have a frank and open discussion on their goals and include lifestyle factors which can influence the aging changes like diet, exercise, and smoking habits. We have our nutritionists. We can always take their help, turn to them for the diet recommendations, and always monitor the weight loss or weight gain, and then study the BCA, analyze the BCA, talk to your clients. Every visit, you please spend 5 to 10 minutes of your time with your client and give equal importance along with your medications and procedural treatment to get that wow results. Then a little note about the inflammatory skin conditions which are affected by lifestyle factors, the most common being psoriasis, atopic dermatitis, and contact dermatitis. So there are a lot of papers talking about how lifestyle can bring down the morbidity associated with psoriasis, especially when it is associated with cardiovascular risks. So these are the papers which talk about the importance of psoriasis. I'm not going to spend much time on that. And then this was another interesting paper which spoke about improvement in atopic dermatitis. So this study indicated that there is an increased risk of atopic dermatitis by approximately 2% for each 1 kg of meter square ascending body mass index. So by each increase of 1 unit of BMI, there is 2% increase in the risk of atopic dermatitis. So it is time for us to start counseling the younger age group. Nowadays we see a lot of pediatric age group clients coming to us with acanthosis, so with atopic dermatitis as well. So we should start our counseling right from the day 1. Eczema, again, hand eczema has also been associated with smoking and other lifestyle factors. And there is a study which is done in terms of volume of cigarette smoking. That is the number of cigarettes that are smoked per day and the duration also. Both had a lot of impact on hand eczema. Hidradenitis suppurativa and diet, again, it is linked to metabolic syndrome. So it's time we think beyond our regular medical treatment and talk to them about weight loss, insulin resistance, etc. So then this is another paper which talks about effects of exercise and physical activity on weight loss and maintenance. So the major thing is now obesity represents a major health problem linked to many of the cutaneous issues, not only cutaneous issues, underlying metabolic syndrome. So it is time for us to take this seriously, and we should start counseling our clients regarding both diet and exercise. We have our Beyond Weight Loss program. We have our BCA, excellent BCA machine. But only thing is we have to give time to the clients, talk to them, have a common consensus, monitor the therapy as well. Thank you.